Hi, Dr. Wang here, back today with a new topic. I want to talk with you about minoxidil, its topical and oral forms in the context of use for male pattern baldness. So, minoxidil, it is a very fascinating drug, and I think it's quite misunderstood, especially when you compare it between these two forms. So, these two forms have such a different effect on the body that it's really a matter of safety that you know what's going on. First, we'll talk about its topical form. In its topical form, it's very commonly used for male pattern baldness. It's readily available over the counter and very easy to get a hold of. Many drugstores will just carry it off the shelf in many different brands. Unless you have some special circumstance or really use it in a bizarre way, it is fairly harmless. It's not a miracle drug to regrow all your hair, but it does have a medically labeled indication to help treat male pattern baldness. A third thing about topical minoxidil is that it generally only works where you put it. So it's nice to be able to control and localize the effectiveness of where you want this medication to go. This way you can keep your hair growing on your head and not somewhere else on your body wherever you're putting it. But problems come up when people take these topical drugs and decide to eat them because they want it to be more effective. And people will just be eating them out of the container and measuring it out in unsafe ways because they think that it is more effective. And they are partially correct. Oral minoxidil is technically more effective than topical, but this is a terrible idea for many reasons. And to understand that, we have to talk about oral minoxidil. So oral minoxidil is a totally different animal from topical minoxidil. It's a very potent arterial dilator. So what it does is it relaxes and opens up your arteries. When it's topical just on the scalp, it opens up these arteries that bring circulation to the hair follicles, and that's how they stimulate the growth. But when you take it orally, it dilates all of your arterial vessels everywhere throughout your body. In medicine, oral minoxidil is actually known as one of the most powerful blood pressure medications out there. It can be used to treat hypertension that's refractory or basically untreatable to anything else. If you take topical minoxidil and orally dose it yourself by eyeballing it, you can risk seriously hurting yourself. Someone with high blood pressure might need it to lower their pressure to normal ranges, but if you already have a normal blood pressure, then swallowing a bunch of minoxidil can lower your blood pressure to below normal ranges, and sometimes very severely, depending on how much of it you've consumed. This can cause things such as organ damage, brain damage, or even death. Now let's talk more about oral minoxidil and its effects on hair growth. Like what other people have talked about online, it is a potent hair grower. That's actually how they found out it grows hair in the first place, is because people were taking it as a blood pressure medication, and then suddenly they just basically grew hair everywhere. It'll grow hair even in places where you don't want it to grow, like every follicle on your body, the skin in the middle of your forehead, literally everywhere. So say you want to grow hair everywhere. Could you use oral minoxidil for hair growth safely? The answer is actually yes, but not by eyeballing the dose and swallowing a bunch of this drug from its topical form. There are some studies out there that have shown that very low dose oral minoxidil can be more effective than a topical minoxidil and almost as safe when carefully monitored. If that's something you're interested in, you can talk to your doctor and see if it's a good fit. You could also already have high blood pressure, and that needs to be treated anyway, and with an oral minoxidil medication, you could possibly kill two birds with one stone. Granted, this is if you want to grow hair literally everywhere. But the most important thing is to get a prescription with accurately dosed tablets and not to just be drinking topical minoxidil. In summary, topical minoxidil is mostly safe, and you can use it to grow some hair with some mild effects where you put it, but don't expect a miracle. Oral minoxidil is a complicated blood pressure drug that can make you grow hair everywhere, but does need to be approached with caution and is a conversation you have to have with your doctor. My personal recommendation is to stick with the topical form, and if you really need drastic changes in your hair loss, you should look towards a different hair therapy or restoration method. So thanks for listening today. New videos every Saturday and branching out to some different subjects in the broader field of healthcare, wellness, and medicine. So thanks for listening. Take care.